Every practice who does anterior segment surgery does YAG capsulotomies, and you have to do high numbers. After 2 to 3 years, almost every patient has to have a YAG capsulotomy. Even lenses with sharp edges will eventually get a secondary cataract. And it is an easy procedure, and I personally do about 600 every year. And these days, with all those premium lenses, clear lens extractions, younger patients getting surgery, they have to have a perfect YAG capsulotomy. They get premium lenses and they need a premium YAG capsulotomy. In my floater clinic, I quite often see patients that have had a YAG capsulotomy, where during the YAG capsulotomy, floater have been created. So an iatrogenic floaters, my type 5 floaters. For instance, what leads to floaters very often is the so-called can opener technique. You just cut across a circle and cut the capsule out, and you just leave it in the vitreous. And it shrinks together, and sometimes there is a lot of epithelium still on it growing, and it can bump around like a ping pong ball in your eye. And that can be very disturbing for the patient. Here I show you an example of a patient showed up a year after the YAG capsulotomy, and he said, I'm seeing a ghost, a shadow in my vitreous field all day long. I looked at the eye and saw a remnant of the capsule just floating up and down, as you can see on the image. This casts the shadow onto the retina, what you can see here in the optos image. And you see down on the right side the shadow of that floater, and now after the treatment that shadow is gone. This is not necessary actually if you do the YAG treatment correctly. I decided to go for Ellex because the visibility is so much superior to other lasers on the market. The illumination beam is coaxial to the treatments and observation beams, and you can see details you have never seen with other YAG lasers. Quite often you're just blinded by the red targeting lights, and you get reflections and you can hardly see what you're doing. But with this laser you have a fantastic visibility behind the lens. Let me show you what I can do with that laser. Look at this image. You see a triangle, and you can transform the capsulotomy in a quadrangle or even into a 6-angle, which is my favorite choice when I do YAG capsulotomies right now. I have never been able to achieve this with other lasers. You can see here, you place the laser in the angle and you defocus it by 2 millimeters, and it's just like cutting wood logs. Then you go to the next angle and you open it until you're happy with the shape, and finally you clean all the edges from the epithelium, and then you get such a nice result like what you see here on those images. By defocusing it by 1 to 2 millimeters, you're far away from the eye, and I hardly ever have pitting, and I'm so happy about that.